All right, so let's get into blood pressure. We're going to be recording two measurements. That'll be the systolic and the diastolic. Your systolic will be the measurement that's obtained during the contraction of the heart. This will be your top number. Then we'll talk about the diastolic. That'll be the bottom number. That's the measurement that's obtained during the relaxation phase of the heart. So let's get into locations. And remember, if you already have your BSI on, that's okay. But if not, make sure that you do put it on. For this skill, I'll be using gloves. So we can use the upper arm, and that'll be the focus for this skill. You can use the forearm, the thigh, or the lower leg. Sites not to use would include sites with fistulas, shunts. You want to make sure you expose and you gently palpate that area to make sure that none of those are present. And ask the patient if they've had any mastectomies. Or maybe the patient has contractures where you can't even move their arm and you can't access that site. But that's a good time to consider your alternative sites. Okay, so let's talk about our cuff. So this will be your blood pressure cuff. Here is your bowl and your dial. This one has to be easily accessible to you because this is where you'll be obtaining your measurements. And this should be 2/3 of the size of your elbow going to your shoulder. Okay, so let's check it out. Is it 2/3? Yes. And then this will go about 1 inch over. We'll get into that during the skill. And then also make sure that you have your stethoscope present, okay? So this will be ours. So let's palpate the area, and that'll be where you're going to be placing your stethoscope and where you want to listen. Without further ado, let's get into the skill. Okay, so again, we said we have our blood pressure cuff. We're going to put it over the extremity, and we're going to fit it snugly. Not tight, because that will give you an inaccurate blood pressure. If you use one that is too big, you're going to get a blood pressure that's too low. And if you use one that's too small, it'll give you a blood pressure that's too high. So we'll adjust it, and again, it is 1 inch above the antecubital space, where you'll be putting your stethoscope, and attach it to the patient's clothing, again, so that you can see it. And then our cuff. And then our bulb. And then here's where we'll be palpating, not using your thumb, using your 2 other fingers. Okay, so our pulse is present. So let's grab our stethoscopes. Hold this for me, please. Put this on your ears. Grab the diaphragm here. Sometimes there's a diaphragm in a bell. Rotate it and make sure you can hear the tapping. Keep this at the level of the heart. Place it over that brachial artery. And when you're tightening this, make sure that you don't go too tight or it'll be almost impossible to undo. Just make sure that you tighten it so that it's hand tight. Okay? It'll make it easier to release. So I can hear the sounds. I'm gonna pump the cuff so that it's absent, and then I'm going to go 2 to 3, 20 to 30 millimeters of mercury above, and then release slowly at 2 millimeters per second. The first sound that I hear will be known as the first crock cough. That'll be the first of the repeated tapping that you're going to hear. You're going to want to remember that number because that's your systolic measurement. You'll keep listening until you hear your last tone before the tone completely disappears. That'll be your last crock cough or your diastolic measurement. And then you just release the cuff so all the air is released. Okay? And on critical patients or patients who have received medications, you're going to want to reassess their blood pressure every 5 minutes, and on stable patients, every 15 minutes.